Welcome again to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Eon, and every week I'll be chatting with Dr. Clifford Yudelman, take a nice deep dive into the world of dental care from a consumer's perspective. Whether you're looking to brighten that smile or protect your wallet, we have got you covered with practical advice and also the latest insights. So stick around as we uncover the secrets to maintaining both your dental health and also your finances. Dr. Clifford Yudelman, welcome back.
Hi, Eon. Thanks for having me back. And we've got a great episode today for all our listeners.
An in-depth look at dental veneers. Okay, so that's going to be very interesting. A lot of the times you see famous people with that perfect smile, and then you go and you read, and then a lot of times it's dental veneers. What exactly are dental veneers, Dr. Yudelman?
So basically they are thin shells that cover the front of a tooth in many cases. Sometimes they wrap around over the top or in between the teeth a little. And the main purpose is to improve appearance. They can be made from porcelain or more modern material called lithium disilicate or Emax. And then even newer now is composite resin veneers. And they address issues like misshapen teeth, or if a tooth is small, or if a tooth is damaged or worn down, or in some cases severely discolored teeth that are not amenable to whitening. They're less invasive than crowns, but they work better than just normal bonding, which we'll talk about in another episode. And the main focus at OptiSmile is preserving your natural teeth while enhancing your aesthetics.
Okay, so can you tell us about the different types of veneers? Because you just mentioned you've got porcelain and composite. What's the difference between those?
Yeah, so porcelain, or the newer version of porcelain, which is even stronger than the original porcelains, they're very durable. They can pop out if they're not bonded properly or not done properly, but in general, they stay in. They're stain resistant. They can have a very natural appearance if you go to a dentist that specializes in them and uses a very good lab. Composite veneers are about a third of the cost, and they don't involve tooth removal, and they're much easier to repair long term. The porcelain can last longer, but it's more expensive up front. And the composite is done all in one visit, whereas the porcelain, it requires several visits. And at OptiSmile, we do both options depending on the patient's needs and preferences.
Okay, so what kinds of dental issues can veneers help with?
So the main thing that we see these days is erosion and wear on teeth. So a lot of times it's where patients have had crooked teeth for a long time, and then we straighten their teeth, but that doesn't sort out the problem of teeth that have worn or misshapen because of wear and tear. Severe staining on teeth that doesn't bleach out, or lots of little hairline cracks, discolorations, and then gaps, if there's gaps between the teeth. So in some cases, there's gaps that can't be closed with braces or Invisalign. These are closed by changing the shape of the teeth. For instance, where teeth are small, like the side front teeth can sometimes be what's called peg laterals, and veneers are perfect. So structural issues like chips, cracks, we mentioned worn down teeth, misshapen, if they're uneven. They sometimes used as an alternative to orthodontics for misalignments. In many cases, we see where they're overused or should we say abused, and you get this turkey teeth phenomenon that we've spoken about before, where the patient would have benefited from rather having some maybe 14 to 20 aligners like Invisalign, or even braces. And our philosophy at OptiSmile is to have a comprehensive assessment to determine what's best for you.
Okay, and now, Doctor, can you walk us through the process of getting dental veneers at OptiSmile? What can we expect?
So it always starts with, you can start with a video consultation, which is a free video consultation. You send some photos through on WhatsApp. or then we speak to you over a Google Meet or Zoom. But basically, then you come in, we do a full examination to check on your dental health. We take x-rays, we do photos, and we do a 3D digital scan. And the next step is creating a virtual model of what the expected result will look like. It's commonly known as digital smile design. So it's using special software to design the size and shape and texture of the teeth. And then you would come back if it's for traditional ceramic veneers, and there's tooth preparation where we smooth off or remove a little bit from the front of your teeth. Our preference at OptiSmile is to do the composite or injection molded composite veneers, which doesn't require any tooth removal. But there are cases where someone's had veneers before, or where the teeth do need the surface to be smoothed back a little to be replaced with the veneers. And we basically, after that, we scan your teeth, we make temporary veneers, and then we send the scan to the lab. The lab makes the new veneers, and you come back and we bond the veneers into place. If it's injection molding veneers, which we'll speak about further, those are done directly onto the teeth. And then we follow up to make sure the patient's happy and to give care instructions.
And then how does your digital smile design technology work, and why is it beneficial for patients?
So there's now very advanced software, and the technician that we use, they use AI and also human artistic qualities to visualize how the patient's face will look with the new teeth in place using the photos and the 3D scans. And we can show patients so they can see the expected results before they even undergo treatment. And it's tailored to the individual patient's face and preferences. And it gives us a very high degree of accuracy in the final result. And our philosophy at OptiSmile is to use this technology so we get optimal patient outcomes.
When choosing between porcelain and composite veneers, what should patients consider?
I think it's best to listen to the dentist. We're seeing such good results with composite these days that we generally will discuss going towards composite in many, many cases, especially younger patients. The composite is more affordable. The porcelain is more expensive. The porcelain can be more durable and stain resistant. The porcelain can chip or break or come out later on, and they're more difficult to repair or replace, and they end up being more expensive. The porcelain, you also have to remove some tooth, as we discussed, whereas composite, we don't have to remove any tooth. They both have a very natural look these days, and the composite is quicker to do than the actual ceramic ones. I mean, just to give you an idea of cost, the lab fee alone to make a single veneer, which we usually do 6 or 8 or even 10 upper teeth in many cases. And the lab fee alone is about 3,500 to 4,000 Rand to get a good veneer from a lab. So already the cost of the lab fee is 40,000 Rand. And with injection molded composite bonding, your total fee could be that, depending on how many teeth you have. So there is a very big difference in the cost. But our philosophy at OptiSmile is to help patients make informed decisions based on their goals and their budget.
Do you get any situations where veneers might not be the best option?
Yeah, so in cases where there's extensive decay, a lot of the tooth is missing, some of those teeth may need a crown instead of a veneer, because a veneer is preferably stuck onto enamel, which means that the tooth is still quite intact. If someone's got severe or has gum disease, they may require treatment before you can consider any kind of veneers. And we wouldn't want to put veneers on someone who has bleeding or severe recession or gum disease, bone loss. If there's severe misalignment, we always recommend Invisalign aligner treatment, or in some cases we send patients for braces. We don't like to use veneers to straighten teeth. And structural limitations, like if there's not enough enamel for bonding, if there's already a lot of the tooth has been drilled away or missing for one reason or another. If someone's a very bad grinder, people who grind their teeth very, very heavily, then there might be cases where crowns would be better. And you really want to make sure the dentist does an honest assessment and make sure that veneers are the right solution for you. You don't want to just go into so-called cosmetic dentists and say, I want veneers, and they're going to say, sure, and give you veneers when maybe it's not what you need. You need a dentist that's going to give you the pros and cons and other alternatives as well.
So apart from compliments on your photos that you post on social media, people saying, your teeth look lovely, what kind of results can patients typically expect from veneers? And also, how long do they usually last?
So generally the teeth are much more even. You get an aesthetically pleasing smile. We can change the shade of the teeth, make them whiter. We tend to not want to make them that very, very, very white color, which is quite popular. I think those patients will find that when that trend is over, they're going to be stuck with very white teeth that everyone knows are fake. The teeth just can't be that white. So we tend to, it's very rare that we always try and encourage patients towards a more natural look, more of a European look than a American look. Porcelain veneers can last 10 or 15 years. I just recently saw a lady who's had veneers for 20 years, but they probably started looking a bit stained and problematic maybe 5-6 years ago, and she finally got them replaced before moving to Australia. So we did 10 veneers for her. They looked amazing. She was very, very happy. And again, I didn't make them super white. We just gave her something very, very natural. They look just like teeth. There's always a noticeable improvement after the procedure, and one needs to make sure you go in regularly to make sure that they do last a long time. And we always, committed to delivering lasting and satisfying results. Yeah.
And any success stories or patient testimonials that you want to share with us about veneers at OptiSmile?
Yeah, so I'm not very keen on posting before and after photos. When patients come in, I will pull up 5 or 10 or even more cases, recent cases where patients have agreed to let me show their photos one-on-one. In many cases, it's patients that have gone onto Google and written reviews. Just in the last 10 to 14 days, we've had 5 or 6 reviews. A lot of them are from patients that have had veneers or injection molded composite bonding or injection molded composite veneers. So if you go on our website or onto Google and you look at the reviews, patients mention veneers and you can see what type of results they've had based on what they're saying. And when you do a video consult with us or you come in, we'll show you exactly similar cases and what type of results we've had. And yeah, we like to build trust with these types of success stories. It helps the patients feel good, and we always feel great, of course.
And then finally, Dr. Yudelman, any tips that you have for us about keeping those veneers looking great and lasting as long as they possibly can?
Yeah, so the usual, what we've spoken about before is brushing and flossing, especially flossing before you go to bed, making sure that you use a soft toothbrush and you're cleaning along the gum line, making sure that you don't brush too hard with a hard toothbrush and get recession, because then the edge of the veneer will show and eventually get stained, especially if you drink a lot of espressos or, like myself, Americanos or tea, rooibos tea, things like that can stain. Those types of stains can generally be polished off, and cigarettes generally never make your teeth look nice. I mean, we always recommend people try and give up smoking, because not only is it bad for your gums, but it will stain around the veneers. And getting regular checkups, for a lot of people, getting a cleaning every 6 months and a checkup is very important. Some people come more often, other people only need to come once a year. And yeah, we like to give people ongoing support and guidance so they have long-term dental health. I think we covered a lot today. We'll talk about dental bonding next week, which is fairly similar, but it's different. So I look forward to chatting with you next week.
Thanks, Dr. Yudelman. Yes, indeed. Looking forward to that. And thank you once again for your time and sharing your expertise with us. We really appreciate it.
Pleasure. Thanks for having me on, and speak to you next week.
And remember, while we strive to provide valuable insights here on Save Your Money, Save Your Teeth, we always recommend that you consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe for more enlightening discussions and join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.